I'm slightly lost for words, which I know you know is not my style, but I've heard it all and everybody has heard it. And I don't believe for a minute that either of our ministers here have turned a deaf ear or don't feel what's been said or haven't done their best. But equally, I don't believe that our school teachers, our SNAs, I've never dealt with the teachers' union, but I don't believe that they're there for any other reason other than to come to a proper solution, and a solution that sees our most vulnerable children back to where they should be. There's a very huge burden on everybody here because it's not a simple solution. I've had representations from all sides. I have teachers. I haven't one teacher, by the way, who doesn't want to go back to work. I haven't one SNA who doesn't want to go back to work. Certainly they have issues, and they range from childcare to safety concerns to vulnerable family members that they're concerned about. And in the same way, I have parents who just can't cope without having some form of respite, even in the frame of education for their children. I have other parents who are worried sick that if the service is open, would they be bad parents to send them back with the fear of COVID? The reality of this situation is it's very, very difficult, and the one common denominator is everybody is scared, including me. I'm scared that if the wrong decision is made here, it's going to have the knock-on effect of an outbreak for the most vulnerable. I share the same concern as the teachers and the SNAs. I have to put my faith in all concerned that are trying to put this together, that the reasons they will make that decision will be for the right reasons, not so as that it will be politicised as something that the government got right, not that the INTO would use it for their own expedience as the main teachers' union. And I'm certainly not here to politicise it. I'm here to offer my support. If there is anything I can do, I will do it. At the moment, all I can do is keep parents informed, SNAs informed, as to how things are going, because certainly all of the communications I've had, I've passed to the department, I've passed to the minister. I have never, I have to say at this point, had anything but proper communications from the Department of Education. In relation to other matters, yes. On this, I don't expect a response to every email because there have been hundreds. But I expect that every email has voiced a different level of concern, and that concern has been taken on board. And you can hear it here today. Every deputy understands what the issues are. I concur mainly with those who say that maybe the solution is to go into a tunnel. All sides stay away from the media. This is not about who wins. This is about getting it right. And there may be solutions whereby we can do antigen testing. There is affordable antigen testing. That may be one solution. There may be a solution that we need to take the SNAs and the teachers up the list of the vaccine. It's all very, very difficult. It's even more difficult when every day we have our daily reports from NEFIT, and as general members of the population, not in the sphere of teaching or SNAs or with special needs children, all we hear is stay home. This is highly contagious. And then we are expected that these cohort of people all accept just readily that our schools are safe. And I accept when the minister says that the medical advice is that the schools are not risk-free, but they are safer. And I think what's wrong here is that there is an element of confusion for people. How can on one hand we be told to stay home, this is highly contagious, and on another it's acceptable to bring our most vulnerable cohorts of people into one setting, and in many instances, and this is not something that I believe is the fault of a 40% reduction in PPE gear. I have had no representation on that matter. Anybody that has come to me for PPE gear has been resolved. By no means has it been about money. But I do believe that there are certain settings not suitable for social distancing. And the very nature of what is entertained here is absolute physical contact between those with the special needs and those providing the care and the service. I'm not going to drag on, Count Corla, because although I have 5 minutes and I had prepared a little question on the Leaving Cert, there'll be another day. But I would ask that if my services are required as a politician, I'm there to offer any help I can be. And for all that, all I can do for my constituents at this time is support them when they call me, answer their messages and their emails, and wait for the process to conclude successfully. Thank you. Thank you, Minister.
Thank you, Deputy Murphy. Minister.
Yeah, and thank you, Deputy. And Deputy, I do want to acknowledge your very positive and very constructive contribution here this evening, and indeed your positive and ongoing positive contribution to every debate in the education sector. I would like to take the opportunity briefly as I can when you reference the concern amongst teachers and SNAs and others working in the school community. I know those concerns. I engage on an ongoing basis with the representatives of all of the people of whom we speak, but I also engage on a personal level with teachers and SNAs, school secretaries, caretakers, you name it. This is the community from whence I come. These are the people I know. So I know when you say that there isn't a teacher and there isn't an SNA that doesn't want to go back to work. That is 100% correct. I know that. I also know that, we're living in a society at the minute with heightened concerns, but I want to assure them, as I have said from the outset, I will always follow the public health advice. I have followed it, and indeed has the Department of Education, Minister Madigan, from September right through to December. I am following that now, as they have told us, that schools are controlled environments, that they have confidence that we can provide for children with additional needs in these settings. Many of these classes, we're talking about 18,000 students out of a population of 1 million classes, many of them just 6 pupils there. So I follow the public health advice.
Thank you,
I have the interests of all within the education sector at heart. Thank you.
Thank you very much.